Good morning, all the beautiful ladies. This Sunday morning, we are starting with our third webinar, which is organized on the topic named Health Milestone to Empower You. This is for all of us to understand that as we work and as we, grow, uh, how we need to take care of our health post our 30s, post our 40s. And I believe every one of us have some or the other thing on a daily basis to look at. And hence, today we have our two key speakers, a trusted voice, Dr. Girija Wagh ma'am. I guess she's caught up with some back-end work at her end, so she'll join with us shortly. And Dr. Prachi Deshpande Makasar ma'am, who will walk us through the women's health after 30s. We have the voice behind this initiative, Mrs. Sujit Kadam, who will run us through what was the thought that she brought this up for all of us, for all the Bharati Arogya Sakhis. And I would like her to. Over to you, ma'am.
Good morning. Good morning, everyone. Can we make sure that we're all on mute? I know that we're waiting for a few people to join in, but also at the same time is of essence. सगळ्यात महत्त्वाचा टाइम असतो आणि first two sessions we wanted to wait a little longer for everybody to join in म्हणून आम्ही थांबलो. But going forward, we would like to do the sessions. We would like to start the sessions sharp in time. कारण संडेला आपण सगळे आवर्जून येता, आपला वेळ काढून इथे येता to learn something. So we also respect your time. We also understand की सगळ्यांचे घरचे कमिटमेंट्स असतात ते सोडून आपण येता. सो त्यामुळे आपण नक्कीच we're going to start on time. We'll send out an email next time की आपण sharp किती वाजता सुरू करू. Anyway, before all of this, a very, very good morning to everyone and a very happy Sunday to each one of you. आणि I was really looking forward to this session today. आपलं आज हे थर्ड सेशन आहे भारती आरोग्य सखीचं. आणि ऑनेस्टली जेव्हा आपण सुरू केलं तेव्हा I didn't imagine की आपले 2-3 सेशन्स होतील. आम्ही एकच सेशन सुरू करायच्या विचाराने हे सुरू केलं की पेरीमेनोपॉज हा आज मोठा टॉपिक आहे जे आपल्या एज ग्रुपमध्ये 30 to 50 मध्ये सगळ्यांसाठीच उपयोगी होईल म्हणून आपण सुरू केला. आणि पण सगळं जे हे एन्थुझियाझम आणि सगळ्यांचे एक्साइटमेंट बघून आणि मला खूप लोकांनी मेसेज पण केले, ईमेल्स पण केले की हे सेशन्स खूप हेल्पफुल आहेत आणि वी आर गेटिंग अ लॉट ऑफ गुड फीडबॅक इन टर्म्स ऑफ व्हॉट ऑल सेशन्स यू ऑल वॉन्ट टू डू. सो हे बघून आम्ही सेकंड सेशन सुद्धा केलं विच वॉज योगा सेशन. आणि आता हे आपलं थर्ड सेशन आहे आपल्या सर्वांचंच. So I must say I'm genuinely excited and energized about this entire Bharati Arogya Sakhi initiative. It's been heartwarming to hear so many of you come up and tell me how meaningful and relevant you find these sessions. Every session has taught me something new. आणि ह्या सेशनमधनं माय ओनली होप इज की आपण सर्वांनीच काहीतरी शिकावं आणि वी गो बॅक अँड इम्प्लिमेंट ॲटलीस्ट वन थिंग. सो इवन वन थिंग दॅट वी इम्प्लिमेंट, इफ इट हेल्प्स अस, इट विल बी ग्रेट. सो I think that your participation, your feedback, and your presence, whether you're attending live or you're watching the recordings, it gives me immense motivation, energy, and enthusiasm to curate something purposeful for each one of us. So every session is not just about sharing, it's about something new, learning something, taking back something valuable for our own lives and for our health. Today's session, like always, is all about our own health, specifically women's health. And we all know, आपल्या सगळ्यांनाच माहिती आहे की women's health is something that often gets neglected, including we ourselves neglect our health. We prioritize everybody else's health in the family. मग ते मुलं असतील, स्पाऊस असेल, पेरेंट्स असतील आपले, किंवा आपण आपल्या टीम मेंबर्सचे पण हेल्थची चौकशी करतो, त्यांना सांगतो 2 गोष्टी. पण आपण स्वतःची वेलबिंग आपण सगळ्यात शेवटी ठेवतो. हे मी बघितलेलं आहे. So I truly believe this is where the thought behind this entire initiative took root, that we need to recognize that our health must come first. You cannot pour from an empty cup. When your own cup is full, only then can you care for others in the way that you wish to. As working women, we wear so many hats. We are experts at multitasking. Sometimes it feels like multitasking should be our middle name. The moment we step into the roles of a wife and a mother, we automatically begin juggling countless responsibilities. And if we choose to pursue a career alongside that, then multitasking becomes our superpower. This is something that I definitely want to put this out. आपण सगळेच मल्टीटास्किंग करतो आणि ही आपली सुपर पॉवर आहे. But in all this, we tend to overlook our own needs. We take pride in checking off everything on our daily list. मुलांचे टिफिन गेले का? आपल्या हस्बंडचा टिफिन गेला का? मुलांचा होमवर्क झाला का? मुलांनी एक्सरसाइज केला का? त्यांचं काही प्रोजेक्टचं काही काम राहिलंय का? आपले सासू सासऱ्यांना हेल्थ चेकअपसाठी घेऊन जायचं. हे सगळे लिस्ट आपण टिक ऑफ करत राहतो. आणि ह्या आपल्या सगळ्यामध्ये आपल्याला न्यूट्रिशियस बॅलन्स डाएट सगळ्यांना मिळतंय का? नाश्ता मिळाला का? जेवण मिळालं का? डिनरसाठी काय? संध्याकाळसाठी काय? आपण जरी काम करत असलो तरी आपलं माइंड इज बिझी इन ऑल दीज अदर थिंग्स. And we are often first to wake up and last to go to bed. And everything in between is a circus. But you know what? This circus is beautiful too. I couldn't imagine my life without this circus. But within this lovely madness, we must make sure that we give ourselves time, that we prioritize our own health. Only then can we continue to run this circus joyfully and sustainably. And when I say health, I don't just mean physical health. I mean mental health, emotional health, spiritual health, social health, and of course, physical health as a holistic picture. So, today we are going to talk about something extremely practical and necessary: how to measure your health. Because what gets measured gets done. This is my real belief. So, it's important to track where you stand, where your health stands on a year basis. And as doctors recommend, आपण 20s to 40s मध्ये असलो तर आपला फुल हेल्थ चेकअप once in 3 years तरी झालाच पाहिजे. Between 40 to 60 आपला हेल्थ चेकअप 2 वर्षांमधनं एकदा झालाच पाहिजे. आणि post 60 years, we must get our health checkup done on a yearly basis. And through this session, we want to bring awareness to these essentials. Our goal is to equip you with the right knowledge की काय टेस्ट केले पाहिजेत, when to do them, what are the reports saying, and most importantly, do not be afraid of these health checkups. Instead of seeing them as a stress point, we must look at them as an investment into our future, our peace of mind and our strength. So, keeping this in mind, we have today with us Dr. Prachi, who has been with us at the Bharati Hospital, and she will guide us through exactly these topics. Dr. Girija Wagh, who is also been at Bharati Hospital with us. They will talk us through the key aspects of measuring and managing our health and share their insights. हे तुमचे काहीही क्वेश्चन्स असतील तरी आज ह्याची उत्तरं सुद्धा त्या तुमच्यासाठी द्यायला तयार आहेत. सो विदाउट फर्दर डिले, I hand it over to you, Girija ma'am and Prachi ma'am, to take it forward. Thank you so much.
Thank you so much, Swapnali ma'am. I guess ma'am has covered and highlighted the key important things that we miss on our day-to-day life. And without any further delay, I would like to request Dr. Prachi ma'am to please take it over. And Piyush sir, can you please share and start? And we can start with her presentation.
Good morning, dear all. I hope I'm audible. I'm Dr. Prachi, your Arogya Sakhi today. I'm a physician and I wish to greet you and meet you all today and take you all through a journey which is aimed at healthy aging. So I work as a professor and consultant physician at Bharati Vidyapit Hospital, and you meet me anytime there whenever you want to or wish to screen yourself. Next, please. So today's topic is Women's Health After 30, a guide to wellness, screening, and lifestyle management. Now we all know that age of 40 was supposed to be or considered as a middle life, right? But why now this magic figure of 30 has come? So as we all know, because of environmental changes, the food habits, the lifestyle, this has brought the changes that would occur at the age of 40. They have little preponed, and we don't want to miss out on the time to prevent them or to control them. That is why we have to be aware of all these changes that occur right from beginning, that is age 30. Next, please. Next slide, please. So what is the goal of today's webinar? So the goal is we have to understand what all changes that we undergo after the age of 30. We should aware of our own signs and symptoms that give us an alarm to look for the help and visit our doctor. And learn and recommended the screening test which are supposed to be done. We should know the average normal ranges that they are. Like for hemoglobin, what is the average normal range? What is the range for the BSL? That we should know as our own knowledge. And we have to apply the evidence-based lifestyle interventions to prevent and to control the various diseases and to keep them at bay while through we age. Next, please. So as I said, this age of 30 is the one where we are all hyperdynamic. Just now, madam has told our life schedule day-to-day basis is hyperdynamic. We're multitasking, and at the same time, what happens? The estrogen starts declining at around mid-30s, and the cardiometabolic risk starts increasing because estrogen has a cardioprotective role in our management of the cardiovascular health. And often this is the time where we are multitasking and we start ignoring our own health. So for that, early screening will always have better outcomes. So in the next slides, we are going to see how do we do it. So what are the common conditions that we look at after the age of 30? So first is endocrine. You know, endocrine is the master gland which is present in our body, which controls the all rhythmic actions of various tissues and organs, out of which one of the most important is thyroid. And we can see the hyper as well as hypothyroidism disorders which occur. Especially we have to screen when we have experienced something during pregnancy screening, or our mother or our sister has some thyroid problem. That is the time we should go and seek for this thyroid testings. Then for PCOS, that is polycystic ovary, Girija ma'am will elaborate on this. Then comes the metabolic. Yes, after 30, the incidence of detection of diabetes 2 mellitus increases. Also, hyperlipidemia or dyslipidemia means the cholesterol increases as the chances of weight gain, lack of exercise. Then hematology. Yes. So anemia is still very, very important disease in our women in India, and it often gets neglected. We think hemoglobin of 10 is okay, so what? Chalta hai. But that is not the case. The optimum hemoglobin has to be more than 12 gram per cent. And we should have our diet and intake to match this requirement. Then gynecological, yes, there is separate session by Girija Vag madam for this. And least last but not the least is mental health, because we all know every lady at some point in time in a day or a week we all suffer from anxiety, depression, feeling of burnout and fatigue. And what is to be done for this, that also we need to see in the next slides. So bone and musculoskeletal health, we all know the peak bone mass that reaches at its peak by 30 years, and after that it starts decreasing. And what are the risks? Sedentary lifestyle, as many of us are engaged in IT jobs where prolonged sitting is the requirement. Then there is intake of calcium and vitamin D are low. There is less exposure of sunlight outside. We don't go outside or we don't walk or exercise in the sunlight. And what it causes risk of fractures. So many times we hear that there is trivial fall in the bathroom or fall in the home itself, and the person or the lady gets the bone fractured because the bone become weak. And why do they become weak? Because of all these things. If not fracture, a lady can also experience some generalized bone pain like low backache or muscle pain like pain in the calves, fatigue at the end of the day. So these are all features nothing but because of calcium and vitamin D and iron deficiencies. So bone mineral density can be actually measured by a machine called as DEXA scan, and it can show us how weak the bone is, how brittle the bone is, and if you had any fracture in the past, or if you have these complaints of bone pain, muscle pain, or any family history, this is the time you should get yourself checked with the DEXA scan and take the measures accordingly. The normal score is more than -1. Next, please. So having looked at the bone musculoskeletal health, then there comes the reproductive and hormonal health, which will be covered by Grija Wag madam in the next session. But just to include what are the problems, I have kept this slide. We will skip to the next slide. So yes, mental and cognitive wellness is one of the most important but most neglected thing. There is high prevalence of major depressive disorder in 30s and 40s because we expect from ourselves a lot, and we expect us to work as superwoman with multitasking. But at the end of the day, we feel that we are burnt out. We feel we are depressed. We are not matching with the expectation with ourselves. Plus, we are also neglecting the importance of sleep, mindfulness, and if required, we have to actually acquire a therapy for all these things. And how sleep is important, we will see in the next slide. So, what is cognitive wellness? So, cognitive wellness, we often experience that we have a feeling of forgetfulness, we have mental fogging, we are not able to concentrate, or we are forgetting the things, miscalculations are being done. This is nothing but the cognitive deficiency, and mental health and cognitive health go hand in hand. So, for that, one of the most important measure is sleep. So, we have to sleep at the same time, at the same place, and we have to actually maintain a discipline and hygiene during the sleep. So minimum 7 to 8 hours of per night sleep is required, which should be uninterrupted. Early to bed and early to rise are the key mantra which are age old, but they still hold true today also. So we have to avoid the screen time 1 hour before the bed. And mindfulness practices like meditation, yoga, or writing, overthinking is negated by writing all the things or making calendars, and manage the workload with time blocking and support networks. So stress regulation is also equally important. Next slide, please. So mental health support strategies is regular sleep, mindfulness, and if at all, in spite of that, you feel that you have lack of interest, you're having low mood persistently, you're not able to sleep properly, then all other things that mind you that you might be suffering from depression, and one should not shy away from taking the opinion of an expert, a psychiatrist or psychologist, should not feel any stigma. Before meeting psychiatrist, psychologist, you have to meet your physician, a family physician, which will guide you that you are suffering maybe from mild depression, and if you take care of it immediately, you can resume your normal life. Next, please. So what are the other non-communicable diseases that are coming along when we pass through this journey of 30s or 40s? So yes, hypertension, diabetes, and dyslipidemia are increasing more and more in even 30s and 40s. We know that regular BP checkup is important. And how is the frequency? I will let you know. So what are the risk accelerator? So one is obesity. One can measure the body mass index, which is measured by the formula of height and weight. It is very simple, can be done even at the home. And it tells you what is obesity. Then if there is family history of obesity or any of such diseases, then one should be on alert mode. Then stress, this also increases the occurrence of all these diseases. So preventive care is more effective than the reactive treatment, and the prevention is through early screening and taking measures to prevent these diseases. Next, please. So this is the table showing chronic core screen test that one should undergo and the frequency. So you have to check your blood pressure annually, and which should be less than 120 by 80. Then fasting blood glucose, that one has to do 10 to 12 hours of fasting. And in the morning, one should check the sugar every 3 years, and it should be less than 100 milligram per deciliter. Then HbA1c is the measure which checks our sugar over 3 months. So it is important investigation that can be done, and it can be done if risk is present. It should be less than 5.7. Thyroid stimulating hormone is the one for screening thyroid disorder, which is very, very important, and it should be done every 5 years if person is symptomatic. And of course, the hemoglobin should be checked every 1 to 2 years, and it should be more than 12. Lipid profile, that is cholesterol, and it can be checked every 5 years. But mind well, someone is obese or someone has family history of any heart disease or something, it should be checked even annually. Or if one report is abnormal, it should be monitored frequently. Then pap smear and self breast examination will be covered by Wag madam. Next, please. So these are very simple screen tests that can be done at your physician's clinic. And mammogram is also the part which has been done after 40 years. Then DEXA scan, just now I told you, to prevent the fractures, we have to check the bone density. And if there is any history of the family of various malignancies, then yes, colonoscopy, although not very routinely done. And ECG and echo are the ones when the person has symptoms. A lady has a symptom of chest pain, fatigue, dyspnea, that is breathlessness, and has hypertension. Yes, then your physician may order an ECG, that is electrocardiogram, which can be done on the basis of symptoms. Next, please. So these are the basic tests which can be done at a screening level in your physician's clinic. So nutrition is one of the most important uh, measure to prevent the diseases after the sleep. Iron should be 18 milligram per day and 8 milligram in postmenopause. How it comes? It is present in the dates, in resins, and in drumsticks. So one can have these food items, jaggery, so that to prevent the anemia. Calcium, the intake should be around 1000 to 1200, vitamin D 600 to 800. So you can check the levels and you correct if they are required. And exposure to sunlight is very, very important. So next is daily nutritional recommendations. As I said, good amount of proteins, carbohydrates which are to be complex, means one should not eat maida or bakery products. They should be strictly avoided, like cake, pastries, and one should have mindful eating. Just like because something is there being offered, or sweets are being given, one should not just indulge of eating them. One should be mindful. What am I eating? I am hungry right now. What I have taken just now before this particular item. So one should eat mindfully. How much sweet I have already had in my day? Should I go ahead with this item now? So that should be the mindful eating. Then more fiber in the form of salads, fruits, and raitas, that should be there. Green leafy vegetables and vitamins and minerals. So healthy fats means one should not eat trans fats. Means what? जो तला हुआ तेल है उसमें से जो पकोड़ा वड़ा समोसा निकलता है वो हमको नहीं लेना है. हमें अगर समोसा वड़ा पकोड़ा खाना ही है तो हम घर में बना सकते हैं. And same oil should not be used. Yes. So coming to the next slide. So this is how is the outline of what healthy diet one can have. Then yes, it is incomplete without a physical activity. So how much physical activity? It should be at least 150 minutes per week, which is around 30 to 45 minutes per day. One should exercise at least 5 days a week. So we can definitely take our half an hour of our 24 hours to keep our years of life healthy. So resistance training can be done 2 days a week. Flexibility can be achieved by yoga. The previous session was dedicated for that. And of course, pelvic floor muscle exercises. You can resort to good YouTube authentic videos to learn those to prevent the urinary incontinence. Next, please. So sexual and reproductive health is also part of our health. So mental, sexual, and reproductive health are also part of our routine health, and they should be covered by, they will be covered by Wag madam. Next, please. So after discussing this all, now when you want to see your physician, or I would say your Arogya Sakhi, So, yes, annually at least you should see your physician as a preventive health strategy. She will examine you, she will assess the symptoms and signs, she will do certain basic things like blood pressure and all. And if required, she will suggest you to do some screening test. So, if there are breast changes, fatigue, menstrual abnormalities, rapid weight changes, sleep disturbances, mood symptoms, family history of cancer, diabetes, then one should screen and see regularly. Next, please. So, so today we have seen what are the signs, symptoms, what are the screening tests, and what are the lifestyle diseases prevention methods. And as I said, we have to abide with all these things, and it is empowerment through the preventive care. Ultimately, health is, as Madam said, health is the most important investment that we can do, and it should be started at early level. So, before I log off, before I say goodbye to you all, we have to remember aging is not actually adding the years to the life. It is graceful maturing, and we should understand it can be still a very happy and graceful thing and enjoyment of the life. So, if there are any questions answer at the end of the sessions, we can cover them. Over to you, Swapnali madam.
Thank you so much, Prachi ma'am. It was a very, very interesting and what do you say? I mean, I've made notes. I was making my
Thank you.
notes while you were
Thank you.
talking about all these things. I mean, of course, from a technical aspect in terms of what should be done when, we have to go to a physician and understand what is required. So we will definitely come to you. But of course, even when you mentioned that, I mean, can you little bit tell us as to when and how often does one need to get tests done? I mean, of course, like your full health check, or how often should one get just a regular blood test done? And what all is seen in that blood test? It'll just give us that guidance on how to not feel scared about going into these tests, and also help us on, you know, um, so also sometimes, I mean, not just being scared, पण किती often करायचे हे आम्हाला माहीतच नसतं. So ह्याच्यावर थोडंसं can you shed some light?
Sure, sure. Yes. So as I said, the way we tell our children while going to vaccine कि घबराओ मत बच्चा वो अपने अच्छे के लिए रहता है. So the way the mother explains to the child while going for the vaccine, similarly we have to explain to ourselves that this is not to be scared about, and it is for prevention of our own protection of our own health. So as I said, blood pressure should be checked annually. At least once in a year one should see the physician. It should be checked, and if someone has suffered from hypertension during pregnancy, then I would say the frequency should be more. Like after pregnancy, the visits should be at least after delivery every monthly or 6 monthly till you are on tablets. And if there is no previous such history, then at least annually after 30, one should go and check the blood pressure. And as anemia is also very high in our country, I think annually one should check our hemoglobin also. And once on the first visit, if we take thyroid, and if it is normal, then one can check it after every 3 years. But if it is abnormal, then yes, up to 3 to 6 months, every 3 to 6 months, one has to check the thyroid. Similarly, if HB is abnormal, you are on treatment every 2 to 3 monthly till it gets normalized, one has to check. And for diabetes, if there is no risk factor as such, then at least once in 2 to 3 years, one should check our sugar. But many times we see there is history of increase in sugar during pregnancy. In that case, one think is this was linked to pregnancy, and after that, should I go again or not? Yes. So after that also it has been found the person may have sugars high. So later on, after that also one has to check sugars annually. Otherwise, if it is normal, 2 to 3 yearly. So BP, hemoglobin, thyroid all should be checked at the first visit, and BP, hemoglobin every year. The rest as per the requirement. Thyroid, hemoglobin, and as I said, sugar are the most important things. And annually vitamin D, yes, because it is also found to be very low. So one has to check vitamin D every year and accordingly get treated.
Okay.
Yeah.
Also, sometimes people get scared. की आता एकदा हॉस्पिटलला गेलं की या टेस्ट निघाल्या की मग बाकी सगळ्या बाकीच्या पण टेस्ट डॉक्टर करायला सांगतील. Also, there is a financial aspect to it,
Yes.
and these
Yes.
are genuine questions. I'm
True.
uh, asking these questions from the aspect that maybe it'll help our audience. की
Yes.
मग तो एक विचार असतो की बाबा चला हेमोग्रॅम किंवा थायरॉइड डायबिटीसची टेस्ट असेल तर ती साधारण केवढ्याला असते आणि एकदा हॉस्पिटलला गेलं की हा टेस्ट मधनं काय रिपोर्ट येत आहेत त्याच्यानंतर मग म्हणजे कमर्शियल हॉस्पिटल्सला मी आपल्या हॉस्पिटलचं बोलतच
Oh.
नाहीये कारण आपलं हॉस्पिटल अजिबात कमर्शियल नाहीये. We are very, very conscious about doing minimal tests and doing the tests that are only required. पण बाकी कुठेही म्हणजे छोट्या क्लिनिक्समध्ये जरी गेलं तरी आजकाल डॉक्टर लिस्ट लिहून देतात की तुम्ही ही औषधं घ्यायला सुरू करा आणि ह्या अजून बाकीच्या टेस्ट करून या. तर ते आपण म्हणजे हाऊ शुड वन लुक एट दिस ऍस्पेक्ट कारण आज इतकं कमर्शियल झालंय
True.
ते आपण हाऊ डू वी काइंड ऑफ अड्रेस दॅट.
Yes, as you said, madam, cost is constrained. So one has to minimally whatever required. I said three tests: blood pressure, HB, and sugar and thyroid. So minimal, but there are various packages. Like our hospital has a good package, so it encompasses and many tests into a very reasonable amount. So I think it is worthwhile to take the benefit of such packages which are offered. And many times we conduct camps also. So one should not lose their opportunity to visit some such camps, and ultimately we end up spending on other things like movie, shopping, malls, other things, going to hotels, right? So I think it is worthwhile spending on the things which are essential, which will take care for 1 year. Like we go and eat somewhere like pizza or something, same 700, 600 bucks are spent just like that for that one day. So I think we can categorize our expenditure for the month, and keeping that budgeting, we should have our health as an important thing on our budget. And secondly, as I said, list can be minimized based on our focused on the symptoms and signs of the patient. But mandatory screening of minimum things, I think, is worth to be done. And as we say, we when we see the report card of our child, and when see there's some marks less on English or Marathi, then we focus on that subject to improvise. Similarly, these numbers should not be scaring us. Like if hemoglobin is low, that's okay, it can be correctable. How it is to be correctable? With medicine and with diet. And I think from physicians responsibility is also that we explain them the dietary changes more than the drugs. One should not rely on the drugs more, but dietary simple measures should help.
Excellent. That was really helpful. Thank you so much, ma'am. And I really take your point. What I'm taking back is one has to be mindful about, investing in your health and keeping a budget in mind for this. So जे आपण शॉपिंग आणि बाहेर खायसाठी जे बजेट आहे त्यातलं
True.
थोडंसं जरी आउट ऑफ 4 वीकेंड्स आपण एक वीकेंड बाहेर न जाता ते बजेट आपण हेल्थसाठी ठेवलं पाहिजे. It's such an important point that you've kind of left us with.
Thank you. Thank you.
Very, very important. And second takeaway for me is that, all these issues that you see in the reports don't have to be corrected with medicine. आपण
True.
न्यूट्रिशननी पण हे करेक्ट करू शकतो. आपण रोज काय खातो ह्याच्यावर जर आपण फोकस केलं, तरी सुद्धा आपण त्याच्यावर we can find the right solution. I think
Very true.
these are the two really good points that I have learned today from our conversation. Thank you so much, Prachi ma'am.
Thank you, ma'am. Thank you
And
so much. Thank you.
thank you. And I think Girija ma'am is here and everybody's waiting, Girija ma'am, also to hear you because Prachi ma'am also in her presentation had a few points where she already mentioned that you will be taking it up. So please, ma'am, on to you.
Ma'am, you are on mute.
Thank you so much, Swapnali madam, for giving us this wonderful platform. Because as doctors, we love to connect to people. And, it's always better to be on that side of the table where you can help, guide, and prevent things rather than deal with them when the storm actually happens. And congratulations for you to creating this platform for all of us women through our Bharati Arogya Sakhi. And I'll just try to get into, I just want a heads up from you. Is my screen seen?
Yes, ma'am.
Yeah. So that was a wonderful rendition by Prachi, and she spoke so well on all the tests that are essential. And it was so nice of Swapnali madam to consider all the logistics so very gently and empathetically. And today we are going to discuss in the next 20 minutes about smarter screening, stronger living, a preventive health guide for women over 30, as Madam Swapnali has told us. So, namaste and a warm welcome to all the incredible women of Bharati Vidyapeeth. Today, we gather not only to discuss health but also to celebrate the power of awareness, prevention, and resilience. And this session is a part of the Arogya Sakhi initiative, a movement dedicated to empowering women with knowledge and tools to take care of their health. And this is a community driven health awareness program focused on preventive care for women of Bharati Vidyapeeth Parivar. And it aims to bridge the gap between knowledge, action, especially for women over 35, through education, screen, and support. And all our hats off and salute to our leader, Mrs. Swapnali Vishwajit Kadam, who visualized this particular thing and her vision. And it's nice to see that it is coming into fruition, and we can see that many people are benefiting from these sessions. So, friends, health is not just the absence of disease, but the presence of vitality. नुसताच आजार नहीं है, नुसतीच मैं बीमार नहीं हूँ, ये बराबर नहीं है. लेकिन हम में एनर्जी कितनी है? How vital am I? How happy do I feel is important. So, हम अगर एक एग्जाम्पल लेंगे, आशा जो लेस देन 32 years old है, she feels very tired and fatigued, and उनका शादी है 8 months down the lane. So, on very close questioning, she also says that she has painful periods, she bleeds irregularly and suffers from gases और indigestion बहुत होता है उनको, एसिडिटी होती है, हमेशा दवाई लेनी पड़ती है. तो अभी इनमें क्या क्या करना चाहिए? आइडियली ये इतनी टायर्ड फील कर रही है तो हमने, जैसे मैडम ने हमको बोला, हीमोग्लोबिन चेक करना चाहिए, थायराइड चेक करना चाहिए. अभी शादी भी हो रही है तो ब्लड ग्रुप जरूरी है और HbA1c जरूरी है, क्योंकि हमारे देश में डायबिटीज बहुत ज़्यादा है. पेनफुल पीरियड्स को इग्नोर कभी भी ना करें प्लीज़, क्योंकि हम बहुत अभी देर से शादी करना शुरू कर जाते हैं और कभी कभार उसमें प्रॉब्लम्स हो सकती है. सो जब भी बॉडी में कोई भी पेन हो, दैट इज़ अ हेल्पफुल गाइड टू टेल अस कि जाके कंसल्ट करो कि ये पेन क्यों हो रहा है. ये लाइफस्टाइल प्रॉब्लम हो सकती है, हार्मोनल एब्नॉर्मलिटी भी हो सकती है, क्योंकि आपके पीरियड्स पेनफुल है और ब्लीडिंग भी इरेगुलर है. इसका मतलब हार्मोनल इम्बैलेंस है. आपके रिप्रोडक्शन के हार्मोन्स एब्नॉर्मल हो सकते हैं, या बाहर के जैसे थायराइड वीराइड भी खराब हो सकते हैं. और गट हेल्थ, पेशेंट सफरिंग फ्रॉम गैसेस एंड इंडाइजेशन, गट हेल्थ का बहुत इंपॉर्टेंट मायना है, क्योंकि गट में हमारा इम्यूनिटी स्थित है. अगर हमारी गट हेल्थ ही अच्छी नहीं हो, हम कितना भी अच्छा खाए, कितना भी माइक्रोन्यूट्रिएंट्स ले, वो हमारे बॉडी को इस्तेमाल नहीं होंगे. सो जैसे हमने इनका टेस्ट किया आशा का, उसमें समझ में आया इनका हीमोग्लोबिन 9.5 था. तो अगर हीमोग्लोबिन कम है तो हमको देखना है कि ये न्यूट्रिशन के वजह से कम है, एसिडिटी के वजह से कम है, बहुत ज़्यादा ब्लीडिंग हो रहा है इसलिए कम है, कि कुछ जेनेटिक डिसीज है जैसे थैलेसीमिया, सिकल सेल है, ये देखना जरूरी रहता है. आपने देखा उनका थायराइड 7.8 आया, और मैडम ने हमको अभी बताया कि ये टेस्ट करना, ट्रीटमेंट लेना जरूरी है. जब भी थायराइड का टेस्ट आता है, पेशेंट घबरा के चली जाती है, उसको लगता है कि ये लाइफ टाइम मुझे प्रॉब्लम होगी. नो. और अगर आप शादी कर रहे हो, आगे जाके बच्चे पैदा करने वाले हो, तो आपका थायराइड नॉर्मल रहना बहुत जरूरी है, और वो 4 से नीचे होना जरूरी है. नॉर्मल बॉडी मास इंडेक्स देखना जरूरी है. आपका जितना हाइट है उतना अपना आइडियली वेट होना चाहिए, और इससे फिर आपको बहुत सारे जो कॉम्प्लिकेशंस है वो नहीं आते. हमने ये पेशेंट का, आशा का, सोनोग्राफी करा, और सोनोग्राफी में दिखा उनको एक सिस्ट है. अगर सिस्ट क्यों हुआ, तो ये क्या ट्यूमर नहीं है, ये कैंसर नहीं है, लेकिन ओवरी काम अच्छी तरह से नहीं कर रही है, हार्मोन रिलीज का काम नहीं कर रहे, इसलिए सिस्ट होते हैं. कभी कभार बहुत ज़्यादा अगर सिस्ट होंगे तो PCOD के सिस्ट हो सकते हैं. कभी कभार जब पेन होता है तो एंडोमेट्रियोसिस नाम की डिजीज़ रहती है, जिसको बहुत जल्दी डायग्नोस करके कंट्रोल करना जरूरी है. ये प्रॉब्लम एंडोमेट्रियोसिस का ऐसा है कि जो भी हमारा मेंस्ट्रुअल ब्लड में से सेल्स चले जाते हैं बाहर, वो अंदर के अंदर अपने पेरिटोनियम में और बॉडी में ग्रो हो जाते हैं, और वो दिक्कतें ला सकते हैं, जैसे बच्चे पैदा करना में प्रॉब्लम आ सकता है. और एंडोमेट्रियोसिस का एक प्रॉब्लम ऐसा है, जब डिसीज शुरू हो जाती है जिंदगी में, वो जब 10 साल के बाद, 11 साल के बाद डायग्नोसिस में आती है। इसलिए अगर आपको पेनफुल पीरियड्स हो तो ये जांचें पड़तालें करना बहुत इम्पॉर्टेंट है। और B12D डेफिशिएंसी, क्योंकि ये आशा को गट हेल्थ प्रॉब्लम था, तो उनमें न्यूट्रिशनल डेफिशिएंसीज हो सकती है। तो जो हमने सोनोग्राफी क्यों करनी है, क्योंकि इसमें से जो कॉमन गायनेकोलॉजिकल कंडीशन है औरतों में वो समझ में आती है, जैसे PCOS, एंडोमेट्रियोसिस और ओवेरेंसिस। ये देख रहे हो अपना नॉर्मल जेनेटल ट्रैक्ट है, इसमें ये ओवरी में बहुत ज़्यादा सिस्ट दिख रहे हैं, ये इसको बोला जाता है पॉलीसिस्टिक सिंड्रोम। एंडोमेट्रियोसिस जैसे मैंने आपको बताया, ये सेल्स बाहर आ रहे हैं। और ओवेरियन सिस्ट आप देख रहे हो, यहाँ सिस्ट आया है ओवरी में, जो बोल देता है कि कुछ प्रॉब्लम है, हमको सुधारो। सो देयरफॉर ये टेस्ट बहुत इंपॉर्टेंट है। नो सिम्टम्स, माइल्ड सिम्टम्स, एडवांस डिसीज, ये सभी चीज़ें के लिए एक स्क्रीनिंग एंड अर्ली डिटेक्शन इज़ वेरी इंपॉर्टेंट। टाइमली ट्रीटमेंट फिर मिल सकता है और हमारी जल्दी से जल्दी हेल्दी रिकवरी हो सकती है। सो आशा ने क्या करना चाहिए? चेकअप के लिए आना चाहिए, ना डर के, ना घबरा के कि मेरे को बहुत खर्चा होगा, कुछ ना कुछ मेरा डायग्नोसिस हो जाएगा, फिर लाइफ टाइम के लिए मुझे लेबलिंग हो जाएगा। डोंट वरी, हम यहाँ आपको हेल्प करने के लिए आए हैं। बेसिक हेल्थ इश्यूज, ओबेसिटी, हाइपरटेंशन, एनीमिया, हाइपोथायरॉयडिज्म को हम डील कर सकते हैं। यही आपकी विंडो ऑफ अपॉर्चुनिटी है कि आप आपके अडल्ट वैक्सीनेशन लो। Every woman when she has turned 18 has to take these adult vaccinations, जिसमें रूबेला, MMR जैसा प्रेगनेंसी प्लानिंग कर रहे हो, क्योंकि ये वैक्सीन अगर हम नहीं ले और अगर प्रेगनेंसी में हमको ये वायरल इन्फेक्शन हो जाए तो बच्चों में अंधत्व, विकलांगता ये आ सकता है। और कैंसर सर्विक्स वैक्सीन ये अभी प्रचलित है, 20 साल हो गए ये वैक्सीन अवेलेबल है। और सभी औरतें एज ग्रुप फ्रॉम 14 to 45 can take cancer cervix vaccine. And then this is also the time to discuss about intimacy counseling, sexual issues, sexual problems, क्योंकि हमारे कम्युनिटी में ये बहुत डर रहता है सेक्स के बारे में, कभी कभार किसी को इन्फॉर्मेशन नहीं रहती। और ये काउंसलिंग भी हम ये before you plan to get married, before you have to have children, or if you are getting into a intimate relationship, it's very important कि आप डॉक्टर का सलाह ले तो हम आपको गाइड कर सकें कि जैसे आप आपको प्रोटेक्ट करें, अनवांटेड प्रेगनेंसी, अनवांटेड MTP ये सब ना हो, इसलिए हमको मिले। सो जैसे मैंने बोला, पेन ये बहुत जरूरी इज जस्ट इज इजंट जस्ट पार्ट ऑफ बीइंग ऑफ वुमन। बहुत बार जब पीरियड्स में पेन आते हैं तो बोला जाता है नहीं 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 वो जाएगा, बच्चे पैदा होने के बाद जाएगा, दवाई खाने के बाद जाएगा। नो, इसको देखना जरूरी है। प्लीज लुक एट योर ओन बॉडी लाइक योर फेवरेट साड़ी, हैंडल विथ केयर, check for tears and don't ignore the lining. सो वाई टेक वैक्सीन्स, जो मैंने बोला, ये देख रहे हैं आपको ये पिक्चर, ये है रूबेला। ये बेबी को क्या क्या हुआ है, रैशेस है, ग्लाइकोमा है, उनके एबनॉर्मल फिजिकल डेवलपमेंट हो गया है। और ये रूबेला से हम ये सब प्रिवेंट करते सकते हैं, जो हमने बच्चे पैदा करने के पहले 2 या 3 महीने लेना जरूरी है, और वो अपने को 20 years के लिए प्रोटेक्ट करता है। हेपेटाइटिस बी एक ऐसी बीमारी है कि जो लीवर को डिस्ट्रॉय कर सकती है, और ये वैक्सीनेशन भी अडल्टहुड में जरूरी है। हेपेटाइटिस बी, HPV वैक्सीन मैंने अभी बोला कैंसर सर्विक्स के बारे में है, और सर्वाइकल कैंसर प्रिवेंट करने के लिए। और जेनेटल वॉर्ड्स, इट्स नॉट ओनली कैंसर सर्विक्स, वहाँ गंदे गंदे वॉर्ड्स जो आ सकते हैं हमारे इसमें, कभी थ्रोट कैंसर्स, ओरल कैंसर्स, रेक्टल कैंसर्स, कोलोनिक कैंसर्स, जो HPV की वजह से होते हैं, इनसे ये प्रोटेक्ट करते हैं। वैरिसेला, ये एक शिंगल्स बोलते हैं उसको। बिफोर प्लानिंग प्रेगनेंसी ये वैक्सीन लेना जरूरी है, क्योंकि शिंगल्स के साथ बच्चे पैदा हो सकते हैं। सो गेटिंग वैक्सीनेटेड इज लाइक अपडेटिंग योर फोन्स एंटीवायरस, quiet, quick, and it saves you from a system crash, and therefore it's very important that you do this vaccination. So before you're planning your pregnancy, pre-pregnancy readiness comes through starting your nutrition, iron, calcium, folic acid, vitamin D supplements, at least 3 to 6 months before you become pregnant, and vaccinations can also be covered in that 6 months period. Now, ये सब करना क्यों जरूरी है? आफ्टर 30 और 35 क्या चेंजेस आ सकते हैं? हार्मोनल शिफ्ट्स होते हैं, मेटाबॉलिज्म स्लो डाउन होता है, बोन डेंसिटी कम हो जाता है, और इसके वजह से हमारे रिस्क फैक्टर्स भी बढ़ सकते हैं, जैसे सर्वाइकल एंड ब्रेस्ट कैंसर। पुणे सिटी में सबसे ज़्यादा ब्रेस्ट कैंसर है इन द एंटायर कंट्री, एंड द इंसिडेंस इज वेरी हाई, स्पेशली इन यंग women. It's between the age of 30 to 40. And I really want to congratulate Swapnali madam for keeping this particular awareness program, because it's very important that women start looking at their breast health as well. Anemia and thyroid disorders and diabetes and hypertension. Emotional health, बहुत ज़्यादा stressful life हो गया है. Stress, burnout, sleep issues also contribute to these problems. So smarter screening and what to get checked. So there are these very important top 7 essential tests, as I would suggest. One is pap smear and pelvic examination. जी हाँ, हम योनि मार्ग से औरत को टेस्ट करते हैं, और ये पैप स्मियर का टेस्टिंग कम से कम एट द एज ऑफ 35 एक बार तो होनी चाहिए. मैमोग्राफ ब्रेस्ट कैंसर के लिए, ब्लड शुगर, लिपिड प्रोफाइल, डायबिटीज एंड हार्ट डिसीज, थायराइड फंक्शन टेस्ट, बोन डेंसिटी, हीमोग्लोबिन लेवल्स एंड बीपी मॉनिटरिंग. बहुत बार बीपी के बारे में मैंने एक्सपीरियंस किया है. जब मैं पेशेंट को बोलती हूँ आपका बीपी थोड़ा बड़ा है, आप जाओ फिजिशियन को दिखाओ, हमारे मैडम से दिखाओ, तो वो बोलते हैं नहीं नहीं नहीं, मैं दवाखाने में आई ना मैडम इसलिए हुआ है. ऐसा नहीं होता. बीपी आपका अगर बड़ा है तो वो ट्रीट करना, उसका कॉज ढूंढना बहुत ही ज़रूरी है. और ये सब चीज़ें आई मस्ट टेल यू कि हमारे भारतीय विद्यापीठ यूनिवर्सिटी मेडिकल कॉलेज के इस्तेमाल में मिड लाइफ क्लिनिक के अंतर्गत हम पैकेज में ये बहुत महंगी टेस्ट बहुत ही कम दाम में देते हैं. कभी भी आपको किसी को भी इंस्टीट्यूशन को अगर हमारे पास आना है ये टेस्ट करने को, आप हमको बताएं, हम आपका ग्रुप स्क्रीनिंग ऑर्गेनाइज कर सकते हैं. वी हैव सिस्टम्स इन प्लेस. ये सब हमको टीम कोऑर्डिनेशन करके आप एक बार आ सकते हो, जहां हम आपके सब टेस्ट करके आपको गाइड कर सकते हैं. Now, stronger living and lifestyle for longevity is very important. Taking good nutrition, iron-rich food, calcium fibers, exercising 30 minutes per day, walking, yoga, strength training, mental wellness through journaling, meditation, social support. ये अभी अब हम यहाँ इसे बैठ के एक दूसरे के साथ बातचीत कर रहे हैं, ये भी बहुत important है हमारे mental wellness के लिए. और sleep hygiene importance of 7 to 8 hours. So, what does quality of life mean? It's how well you live and not just how long. Especially for women over 35, it means managing health issues like high blood pressure, diabetes, osteoporosis, hormonal imbalances, obesity, and fatigue, feeling physically strong and emotionally balanced, sleeping well, eating right, and staying active, having energy for work, family, and yourself. And think of it as maintaining your favorite appliance. If you clean, charge, and service it regularly, it works beautifully, and your body also deserves the same care. Now, the common myths and real talk. I am too young for cancer. Screening is very painful. I will go only if I feel sick. Real talk is prevention saves life. And so your health toolkit is checklist. There are certain apps, local clinics and resources. We are always there at your service, and encourage buddy system for screening. So you come in the groups, we'll help you. Now let's look at the last point in my talk, a quick self-administered health checklist and well-being checklist for women above 30. It's designed to be simple, practical, and reflective of common health concerns in that age group. So ask these questions to you. Physical health. Do I feel energetic most of the days? Have I had my blood pressure checked in the last 6 months? Have I had a blood sugar test in the last year? Do I experience frequent headaches, fatigue, or body aches? Am I maintaining a healthy weight? For reproductive and hormonal health, do I have regular menstrual cycles? Have I experienced unusual pain, heavy bleeding, or missed periods? Have I been screened for PCOS, fibroids, or endometriosis? And have I had a pap smear or HPV test in the last 3 years? For my mental and emotional well being, do I feel emotionally balanced most of the days? Am I sleeping 7 to 8 hours regularly? Do I feel overwhelmed, anxious, or low frequently? Do I take time for relaxation or hobbies? Nutrition and lifestyle. Am I eating iron rich and calcium rich foods daily? Do I drink enough water, at least 3 liters per day? Do I exercise at least 3 times a week? And do I limit processed foods and sugar and outside junk foods. Preventive care: have I had a breast examination or a mammogram recently? Have I taken adult recommended vaccines such as HPV, hepatitis, and rubella? Do I go for annual health checkups, and do I track my health with a journal or an app? Thank you so much. Please remember, the wheel of wellness for women is based on physical, emotional, spiritual, and social balance. And I want to really thank Swapnali madam. My words are always absolutely going to be not enough to be grateful, to appreciate the way she's got us here today to connect and for me to express myself. Thank you so much, Dr. Swapnali madam.
Thank you so much, Girija ma'am, for your insightful, presentation. Um, Personally, for me, again, like I said, I was taking notes, and so many things that you said are a take back for me personally. But before I go into that, should I ask anybody has any questions? कोणाला काही प्रश्न आहेत का? Girija ma'am is also here. Prachi ma'am is also here. Please do not hesitate to ask questions. So please go ahead and ask questions. But yes, ma'am, I think in the meanwhile, if anybody is wanting to ask questions, in the meanwhile, I just want to tell you that, your inputs on vaccines and the awareness was so important. It was very, very nice. I think breast cancer, I think Pune is a capital of breast cancer. I mean,
Yeah, it is. It is.
I mean, I'm feeling so bad about it. Like,
So,
I don't know much.
if I may say, Swapnali, from 20 years of age, every woman should do self breast examination.
Wow.
Obesity and lifestyle stress, like malnutrition, is found to be one of the most important reasons. And
Hmm.
if you have a family history of breast cancer, it's important that you do a genetic testing and a screening on a regular basis.
Okay. Okay.
And at least one mammogram, it has to be done at the age of 35.
35. Compulsory. Very good. And I really like your favorite sari example. That was excellent. कारण आपल्या सगळ्यांसाठी साडी म्हणजे आपली साडी म्हणजे सगळ्यात प्रिय असते. So favorite साडी म्हणलं तर it's even more important. So I really like that analogy that you kind of put it out on your presentation. But I think there are some questions coming in. So I think over to you.
Uh,
Who's going?
Hello,
Yeah.
madam. Can I ask question? Yeah, madam. I just want to know which genetic screening means type you are telling means. Can you please explain further which test?
BRCA1 and BRCA2 can be done. These are BRCA1 and BRCA2 genes which are done. So if you
Okay,
are a BRCA1 carrier or a BRCA2 carrier, then you are at risk of developing breast cancer. So it's important that you do a regular screening and a testing, and that can tell you. Likewise, even for ovarian cancer, BRCA1 would tell you about it. And
okay,
ovarian cancer is also very common. I did not touch on cancer because we are talking more about 30 age आणि थोडंसं positive राहिलेलं बरं असतं. But it's important that you do your sonographies regularly, आता like there are certain milestones in our life. You come of age, minarki सुरू झाली, you are going to get married, you finished your childbearing, you became 40. These are the times it's always better to get your checking and testing done. And then if you come to know things before, it's important. It's easy for us to understand.
okay, madam. Any other or only BRCA 1 and 2?
No, BRCA1 and BRCA2 are now currently, been validated. There are many. There are
Okay, okay,
many things that can be done, but they turn out to be very expensive. Even BRCA1, BRCA2 would cost us 20,000.
okay,
I would just want to tell, there's one Ritu Deshmukh, Swapnali, with your permission. She's saying, can you arrange this group screening in Pune Hospital? No, my dear. You please connect to us. I put my number. We'll do it in Bharati Hospital. You can come and we'll do your screening testing in Bharati Hospital. Not in Pune, I'm sorry.
thank you, madam.
Plus, I think there's a question for Prachi, ma'am. Does
BP
BP?
fluctuates during
Yeah,
pre. Yes, yes, yes.
yeah. I mean,
BP
both of you
does.
can take it. Actually, it's for
Yeah.
both of you. So yeah. And they
From
also want to understand symptoms of menopause. So these
Yeah.
are the two questions.
I think we'll deal with blood pressure first. Prachi, you can speak.
Yeah. So for blood pressure, yes, BP does fluctuates in the perimenopausal period. So if you have symptoms of fatigue or dyspnea, and even annually after the age of 35, one should go and check the blood pressure. It's very simple, non-invasive walk-in office stays, nothing much requires for that. And usually if we found BP little on higher side at the first instance, now we usually tell the patient to sit, relax for 10 minutes, because we also know coming to the hospital itself is a stress, so it is always a double checking. So we always ask them to sit back for 10 minutes, and then afterwards we call them again and check the BP. And we usually we are not in hurry of starting medication right up. And if the BP is just borderline, na, we advise them the changes in the lifestyle and ask them to come back. We also are not very keen to start the medication immediately, as the patient also feels. So yes, it fluctuates and it should be checked.
Basically, everybody should understand we are also women, even if we are doctors, and we are there to look after you and take care of you. We will be every time like a patient comes, I will also correlate myself. ना अगर मुझे ऐसा होगा तो मैं क्या करूँगी? So don't get scared when you come to us. We always take care of you. We'll not push you into medicines or tests unnecessarily. Only the ones which are indicated we'll be doing.
Ma'am, I
Second
Symptoms of
question.
menopause.
Yeah, the symptoms of menopause typically, the first thing that usually women start thinking is hot flashes. Now, what are these hot flashes? You suddenly break into sweat, you suddenly start feeling palpitations. Now, this happens because the level of your hormones are coming down. It's not that they completely drop suddenly, it's over a period of time. Like we discussed in our first session, and you can go to our YouTube recording, we spoke about these menopausal symptoms. So, around the age of 35, 36, usually this drops come in. Now, complete menopause is hit by 47 to 52. Then you'll have palpitations. You may feel depressed. You may suddenly feel like crying. Then you may feel very angry, irritable. And then there are, as the menopause advances, sometimes women see that their skin is changing, it's becoming drier. Sometimes you may have something which is called as a brain fog. You forget things. Instead of putting the iron in the iron table, you put it in the refrigerator. I say, or पहले तो we used to remember quickly all the lists that we used to go and get from the grocers. बट अभी क्या हो रहा है कि वहाँ ग्रोसर के सामने खड़े रहो, हम भूल जाते हैं क्या करना है. So these things is this is brain fogging. It doesn't mean that you're going into some problem or dementia. You need to modify your lifestyle to be able to take care of this. So menopausal transition many times scares women. There's a lot of non acceptance. नहीं मुझे कैसे आ सकता. Yesterday only I had one young woman taking all care from Ratnagiri and 44, and she says, how come my periods are not coming, how come I got menopause? So let's accept it, let's face it one on one and try to find solutions rather than getting into anger issues with it.
we
And
have
then there can be vaginal dryness, there can be urinary symptoms. So these things also happen around the menopausal change.
Okay, we'll take one last question and then we'll respond to everybody's questions for sure. I can see the next couple of questions are reversing high blood pressure, screening in Sangli, a daughter planning to get married, what vaccine should we give her, HPV vaccines after 40 years. So, these are the questions, ma'am. We will respond to each of these questions on email or email. But in the meanwhile, I think that if you can just take one of these questions, and then we can close the session.
Yeah. So vaccines for a woman, for the 25-year-old who is getting married, is MMR, HPV, and hepatitis B. And you can take cancer cervix vaccine up to the age of 45. Even if you have started having sex, you are late, it can still be taken because it will protect you against the severe consequences. And I think these were the only two questions, Swapnali madam, which were there in the chat box. And yeah.
Okay, lovely. So I think there is also a feedback link that we've put it on the group. If everybody can put out your feedback, it'll help us plan our sessions better next time. We want to bring more such sessions to you, which will help you. And this is really what when we plan these sessions, what is the topmost priority is how can we help you? How can we create more awareness? How can we give you more knowledge? And how can we bring better health to each one of you? So I think this is really what we are looking at putting together. I would like to reiterate that we will send out the answers to all these other questions which are remaining. Please send out your email addresses to us, everybody who's put a question. Any more questions also, please do feel free to put in more questions, and we will have all of those answered as well. Yes, so thank you very much, everyone. First of all, I just wanted to reiterate from both Prachi ma'am session and Girija ma'am session, both of you have at the end given one slide which says that, and there are commonalities, right? Sleep. Prachi ma'am also spoke about sleep, how important sleep is, how important exercise is, how important nutrition is. And Girija ma'am, you also spoke about the same three things towards the end of the session. Of course, emotional well-being. I think that is a topic that is so huge and very, very neglected in I think I would say in our country generally, and more so, we feel shy to kind of go ahead and speak to people. But yes, these are the four pillars: sleep, exercise, nutrition, and emotional well-being. Very, very beautifully put out. I think, please, most of you who are here on the session, if you all can take this back and think about it and work on at least one of it to begin with, it'll really give you better health. So yeah, I think aging is graceful maturing is what Dr. Prachi said. And thank you so much, ma'am. It was very nice. And Girija ma'am, again, very, very interesting inputs from you. Like I said, nutrition, supplements, you mentioned your favorite saris, my take back from today's session. So yes, a very heartfelt thank you to Girija ma'am and Prachi ma'am for sharing your wisdom today with us. I'm sure a lot of us have more clarity now as to how to move forward with more strength and confidence to make informed choices for our health. And thank you to each one of you for being here, for showing up on a Sunday morning. And this session was for yourself, so I can see the commitment that you all are showing for your own health, for yourselves. So I'm really happy to have each one of you here. Together, we're building a community where women uplift one another through knowledge and compassion. And we've also taken note of your suggestions of more topics and thoughtful input. So please do keep giving us feedback, and this will help us, shape our sessions better. And thank you for the backend team. Also, thank you for the Bharati Arogya Sakhis, the incredible backend team who's quietly making all of this possible. Thank you very much for being part of today's session. And let me leave you with this gentle reminder: your voice matters, your well being matters. So let's keep walking this journey stronger, wiser, and healthier with each milestone that we cross today. Take care, stay well, and see you again very, very soon. Have a super Sunday. See you all very soon. Thank you. Bye. Bye.
Thank you.
Thank
Bye-bye.
you. Thank you.
Bye.